Welcome everybody to the CalMap School Echo for November. Um, we have a special guest today. I'm going to go ahead and tell you about her before we do a brief mindfulness activity. So Dr. Sara Chung is here. She is a licensed clinical psychologist and a postdoctoral scholar in the Hyperactivity, Attention, and Learning Problems, or HALP program in our UCSF Department of Psychiatry and Behavioral Sciences. Dr. Chung received her PhD in clinical psychology at UC Berkeley. Her research program is centered on improving mental health treatment utilization and outcomes in ethnically and racially minoritized families. Her recent work is in developing training programs for school clinicians to make behavioral treatments more accessible to children with attention and behavior issues in schools. Her research has also examined culturally relevant parenting behaviors in bilingual and bicultural families and treatment barriers and outcomes for Asian American children with attention and behavioral issues. So it feels very clear, even reading that over again, why we invited Dr. Chung, and we're so blessed to have her with us today, especially with all expertise in school settings. So with that, let's move to a brief mindfulness activity, which I'm also leading, and then we'll let Dr. Chung get started. So I'll ask everybody to think about kind of what we're grateful for. I really like gratitude exercises, and especially with a lot of the recent current events, it's been especially important to me. So that's where we're going today. I invite you to kind of rest your eyes. You can turn your camera off if you want. Focus on sitting straight, taking a few deep breaths, if you can, in through your nose and out through your mouth. Focus on your breathing, trying to breathe out a little bit longer than you breathe in. And as you're focusing on your breathing, I want you to consider the activities, the causes, and maybe the pets or furry friends that you value and enrich your life. People who smile at you, cheer you on, family, friends, acquaintances, people you see in your neighborhood, colleagues and peers, and ancestors who worked so that you could live well and continue traditions. Those friends who supported you when you needed a shoulder or a helping hand. Spend some time thinking about those people, things, activities, and how they have shaped who you are in this moment and who you want to be. And when you're ready, take one more deep breath and turn your camera on and come back here. Kind of bask in the gratitude that I hope this helped kind of bring to the front of mind for you. And with that, I am going to say we love to see people's faces. If you're able to turn your camera on, if not, we totally understand too. I'm going to be eating a cupcake. That's part of my self-care for today. So that's welcome too. But with that, without further ado, I'm going to pass it on to Dr. Chung.
All right. Hi, everyone. It's so nice to see you all today and really excited to be here. Thank you so much for that introduction, Evan, and that really lovely mindfulness activity. I felt like I personally needed that this afternoon. So glad to have you all join us for ADHD, learning disorders, and externalizing behaviors in the school setting. Again, my name is Sara Chung. And I am also watching the chat. So in case anyone wants to share any thoughts or questions there, please feel free. All right. So a couple of announcements. I don't know if we wanted to go through these or if they're familiar to everyone.
They should be. We're CalMap. We used to be CAP. And we are live for consults. And besides this Echo series, we also have webinars. And so if you are not getting those emails, let us know and we will make sure you're signed up.
Perfect. And I personally don't have anything to disclose, and no one involved in planning or presenting this activity has any relevant financial relationships. CalMap is supported by federal and state grant funding. And today's learning objectives will be to identify characteristics of ADHD and LDs, learning disorders, and their prevalence in youth across racial groups. We'll also talk about two factors that contribute to the higher rates of externalizing behavior issues among youth with ADHD and LDs. And then we'll talk about the ABC model and using that to understand and manage attention behavior issues in the school setting. So I wanted to start by thinking about the characteristics of ADHD and LDs. And I will turn to this. I invite you all to share an answer to this question. How does ADHD show up in your classroom, your work, your context, your own life experiences? If you could please share a word or phrase by using the QR code or go to menti.com and type in the code 52620138, this code at the top. And I also would encourage you to think not only about the challenges that may show up, but also the unique strengths that you see too. See some popping up. Does everyone see that screen, the Menti? Great. Creativity, I love that one. Distraction, vibrancy, impulsivity, energy, hyper focus, inattention, challenging. That definitely can be true. Unique behaviors, growth. So I love all the positive words that are coming in too. Unfocused. All right, thank you for participating in that with me. And so we do see from all of your responses a lot of the symptoms as well as the strengths and potential challenges of ADHD. And so on the left-hand side, sorry, actually the right-hand side, hyperactivity and impulsivity challenges. These are the symptoms, the 9. These are kids that may be fidgeting, tapping their hands or feet, squirming in their seat, having a hard time staying seated when they're asked to, running around in inappropriate situations. They're also verbally impulsive. They're unable to play quietly. They have so much energy. They're not able to be still for an extended amount of time. So we call this driven by a motor, like they're an Energizer bunny. These are kids who might talk excessively or blurt out answers, and they can't wait their turn in conversations or in games or activities. And so sometimes they're intruding on other people and interrupting what they're doing, maybe pulling on the sleeve as you're talking to another student or another child. And so the inattention symptoms then on the left are less disruptive. So they've historically been less recognized, more easily missed. Let's walk through these together. Please share out any examples in the chat or unmute yourself if you can think of specific examples from the classroom. So fails to give close attention to details or make careless mistakes. These are students who might make mistakes in their work that's messy, they miss questions, they don't read all the directions. I invite you to think of any other examples. Sometimes the work that they turn in might seem mismatched to how capable they really are. Difficulty sustaining attention. This symptom really should be, as someone else mentioned, there's hyperfocus. So it's difficulty sustaining attention. to things that they're not interested in. And I love this comment, does work, but forgets to bring it and actually turn it in. That's a perfect example of forgetfulness in daily activities, and maybe a lack of organization and follow through too. All right. And so we do see that they have a hard time listening when spoken to, not following through on the tasks that are required of them. And that may be that they're able to follow through with the first step, but then lose and forget the second and third steps. And so in conversations, it might seem like they are being internally distracted by their own thoughts, or externally distracted by things around them. Talking over other people, that's certainly one in the classroom. And avoiding and disliking tasks that require focus. And so if it's really hard to pay attention to things that aren't that interesting, you can imagine that it's pretty hard to then get started on the things that aren't super interesting. All right, so in terms of diagnosis, for youth, according to the DSM-5, we're looking for 6 or more of those 9 inattention symptoms. That would be a diagnosis of ADHD inattentive type. 6 or more hyperactive impulsive symptoms for a diagnosis of ADHD hyperactive impulsive type, or 6 in each category, which would be the ADHD combined type. And the other parts of the diagnosis is that they would have had to experience these symptoms for at least 6 months. And the symptoms, some if not all, would have had to start before the age of 12. And that's because attention is the first thing that goes if you're experiencing anything apart from the norm. And so when you're sick, if you have a fight with your family, if you lost someone, if you experience some sort of recent trauma, when you experience these things, you have a hard time paying attention and staying organized. But we do see that ADHD is a neurobiological disorder, meaning that kids are born with the risk of having ADHD and they have differences in their brain. We'll talk a little bit more about that in a bit. But we also need to see that functioning, that impaired functioning across 2 contexts. That tells us that it's more of a broad issue. It's not just due to the one context, the demands of that one context. And so ADHD risk factors, what are some factors that create higher risk in kids and youth for developing and getting a diagnosis of ADHD? There's a genetic risk, and in ADHD specifically, it's higher than personality, temperament, depression, and we do see brain differences in ADHD. There's a smaller brain volume in kids with ADHD, as well as a slower maturation of the brain areas that control executive functioning and emotional regulation. And so in the early environment, environmental risk factors include prenatal maternal distress and illness for both ADHD and LD, birth complications for things like that block the flow of oxygen to the baby's brain, contributes to learning disabilities, trauma, particularly ACEs. If there are 4 or more ACEs, that increases the chances of ADHD risk by more than 5 times, and lead exposure and other toxins. And a huge point here is that parenting style does not cause ADHD or LD. And the child's behaviors do bring out negative interactions, but parenting in itself is not the cause. A lot of parents are blamed for their children's behaviors and inattention. But we do see that parenting interventions can change outcomes. So it's important to think about when thinking about treatment. All right, so the characteristics of learning disabilities. For reading disability, that makes up actually the majority of LDs, 80%. And for those who are less familiar, we're talking about problems in processing speech sounds, holding sounds in short-term memory. It could be fluency, how fast they're reading something and being able to understand it. Writing disability, that's difficulty putting thoughts into writing, and that can involve issues with vocabulary, spelling, grammar, letter spacing, as well as the act of writing. And so being able to control that pen paper connection and keeping all the words on the line within the margins. And for math, dyscalculia, difficulty understanding math operations like following multi-step calculations, transposing the numbers from the board to the paper or from the paper to calculator accurately without mistakes, and using and understanding the different math symbols. There are several more other learning disabilities, such as auditory processing disorder. Those are kids that have difficulty processing sounds because they're misinterpreting information that's coming into their ear. Language processing is difficulty with spoken language, as well as nonverbal and visual motor deficits. And so I wanted to cover a bit about ADHD and their similarities. And we do see that in terms of prevalence, globally, 3 to 8% of youth have a diagnosis of ADHD, and about 8% of youth globally have a diagnosis of dyslexia. And in both, they're higher rates in males and females, and both have higher risk for anxiety, depression, and of course, externalizing issues. It's estimated that about 30 to 50% of youth with ADHD have externalizing issues, and kids and youth with LD have 3 times higher amounts of externalizing issues than those who do not have a learning disorder. And the rates are very varied for how often kids and youth have both. And some rates put it up to 90% comorbidity. So it's very variable. And so to clarify a bit, externalizing issues are characterized by behavior problems related to poor impulse control, including rule breaking, aggression, impulsivity. And ADHD itself is considered to be an externalizing disorder. Other externalizing disorders includes oppositional defiant disorder and conduct disorder. And externalizing disorders on a whole are quite common, about 7 to 10% in kids, also higher prevalence in males compared to females. And they're very predictive of impulse control issues in adults, including substance use disorders and antisocial personality disorders. And so, as you can imagine, with some of the difficulties in executive functioning, emotion regulation that these kids deal with, that there are challenges faced across academic, social, emotional, and family conflicts. And so in the academic setting, their difficulties contribute to difficulty organizing thoughts when reading or writing, characterized by having a hard time completing the tasks. It's harder for them to stay on task and to learn, so there's more fatigue involved through the day. The afternoon might be harder for some kids. And because of this trouble paying attention and completing what they need to do, there's definitely higher risk for grade retention, academic failure, and dropout. And then in social emotional challenges, a lot of these youth and kids are ignored, rejected. They're often bullied or can be the one who bully others. And they can misread social cues and sometimes interpret social cues as threats and challenges to them instead of something else more neutral. In terms of family conflicts, as you can imagine, potentially some of your parents, if your child has having difficulty completing what you're asking them to and their routines and being independent with everything, that can lead to a lot of negative interactions at home. And parents often feel then lower confidence in their own parenting ability when they have kids with ADHD or LDs. And they feel blamed by the school, by providers. That leads to feelings of stigmatization and feeling unsafe. This is especially true in cultures that believe parents are really responsible for their child's behavior, which is quite common in many cultures and especially common in Asian cultures. All right, and before we move on to the next topic, I wanted to cover this briefly. We're often asked about the overlap between ADHD and PTSD. And so I feel like this graphic is a really nice summary. It's from Chad Magazine. And we see that there is this overlap of challenges with concentration and distractibility, trouble with memory and other executive functions, restlessness, feeling really jittery, as well as then engaging in inappropriate and risky behaviors. The difference, though, is that as a part of PTSD, there's the intrusive memories, bad dreams, flashbacks, strong reactions to memories of trauma, etc. But a review paper found that people with ADHD have a higher risk of developing PTSD, and those who have PTSD are more likely to get diagnosed with ADHD. So that suggests that there is a neurological connection between the two. And more research and information is needed here. So are there racial differences in ADHD and LD diagnoses? Does anyone want to take a stab at answering this question?
Yeah.
I heard a yes. I think that was from Megan. No from Myra. All right. So for ADHD, there are racial differences. And we see that in comparison to non-Hispanic white children and youth, racial and ethnic minoritized youth historically and are still experiencing diagnostic disparities. And the study of over 200,000 commercially insured children found that by the age of 12, compared to white youth, Black youth, which is this orange line, were 17% less likely to receive a diagnosis. Latina youth, 23% less likely to receive a diagnosis. And Asian youth were 52% less likely to have received a diagnosis. So there's some quite big, important differences here. Huge disparities, yes. And so let's think about this question together. Why are there racial disparities in ADHD diagnoses? So sitting with this question for a moment, you can share your thoughts using this QR code, or you could enter that code at the top into menti.com. But I'm just curious to hear your thoughts about what's contributing to this.
I'm struggling with the technology, but I can talk. I think
Yeah.
it could be access to healthcare, and I think it's also stereotypes.
Yeah. Can you say a little bit more about the stereotypes?
Like, let's say Asian students are kind of stereotyped to be very serious, and I don't know. I think, yeah, maybe we're just not looking. We're not seeing what's there because of our biases.
Yes, that's such an important point. Thank you for sharing that. And are you all seeing the responses on the Menti? Great, thanks. So we see differences in identification, agreement there, stigma, provider biases, lack of testing and identification, lack of resources overall, a misdiagnosis, which is really important. Thank you for sharing those thoughts. Families attributing ADHD to normal behavior. All right, so let's dispel some myths and talk about some of the facts that we're seeing. Oh, I'm seeing more answers coming in. Lack of resources, cultural feelings about the mental health system, stigma, cultural norms to not seek treatment. Yes. So yeah, you're all hitting on some really important points. So some myths are that youth of different races have different rates of ADHD, or they're experiencing different types of ADHD. One of the common rationale that comes up is that maybe some youths of specific races have ADHD, an attentive type, and it's just harder to tell then and hard to get a diagnosis. We're seeing from the limited data out there that that's not true. And so globally, the prevalence rates across different countries are quite similar. And they're quite similar in the different types of ADHD that we're seeing too, inattentive type being the most common. And it's a partial myth that their parents aren't identifying problem and asking for help. Many parents don't know that label of ADHD, but they know that it's a problem. When their kids aren't functioning that well in school, they're having a lot of trouble at home, they don't have that many friends, they know that they need to seek help for their kids. But what's getting in the way is the different access to healthcare, as well as the unconscious biases that providers and teachers may judge and interpret behaviors seen in ADHD among different races differently. And so that puts vulnerable populations at risk. It perpetuates that disparity, who's getting care, who's not. And that racism and discrimination make it harder for parents to ask for help. And so it makes parents feel more stigmatized, like your child doesn't have a problem when they do ask for help and go in to seek care. Exactly. I mean, many parents don't know how to. And that's why it's so important to start connecting parents with school services and getting this knowledge and this treatment out in the school setting where it's much less stigmatizing for parents to ask for that support. And so for learning disorders, we do see an overrepresentation of minoritized youth. And the point of this slide is to say that when we don't take into family socioeconomic status, so their family education background, their economic status, as well as their language minority status, we do see that there's overrepresentation of Black, Hispanic, American Indian, Alaska Native, and other races in special education. But once SES is accounted for, the ratios just deplete. And so that's all to say that a policy and procedural reform really needs to happen to focus on reduction of poverty and provide resources that families don't currently have. All right, so let's move into what's contributing to behavioral issues in youth with ADHD and LD. And as we talked about, executive function and emotional regulation are directly tied. There's quite a large study that saw that inhibiting response and avoiding risk challenges doing that, challenges regulating emotions are directly tied with these challenging behaviors on the right, like aggression, conduct issues, even self-injury. And there's a learned behavior pattern. Parents and school staff and kids, you teach each other how to behave. And so taking an example from an adult on the school campus, say there's a student who's walking through the hallway and the adult gives the instruction, please walk to your classroom. And say the student says no. What might go through the adult's mind when they hear that no? Some thoughts, maybe how disrespectful, I need to get louder. And so the adult says, seriously, get going, maybe a little louder, maybe even slightly aggressive. And when the student responds no again, the adult might increase that threat. If you don't get to class, you'll get suspended. And so at this point, if the student says fine, what does the adult learn? That they need to yell sooner the next time. And so the adult is then trained to act in that way quicker the next time. But let's say the student says no again. And in this scenario, the adult just gives in and they say, whatever, not my problem. Right. And in this case, then the student learns that they'll keep getting their way if they keep pushing and saying no. So they're teaching each other how to behave negatively, which can increase and escalate issues over time in their relationship. So what you can do then is really teach skills to reduce the impulsive decision-making, behavioral self-regulation skills. I love stop, problem solving, which teaches the stop, take a breath, observe your situation. Visuals, as you've seen in the challenges that ADHD and LDs may experience, really help with prompting and reminding kids how to use their self-regulation skills, as well as their emotional regulation skills. And then you can use the ABC model to break that learned cycle and think about more effective antecedents and consequences. And so with the show of icons, who has heard of the ABC model? It's also called functional behavior analysis, functional assessment-based intervention before-after plans. And the idea here is to identify the behavior in a very descriptive, observable, measurable way, not judgmental, and think about the problem antecedents and consequences that are maintaining that problem behavior, and then describing a goal behavior. So really contrasting that problem behavior with a positive opposite, and then thinking about how can we change the youth's environment to encourage their goal behavior and set them up for success. Potentially, it's really setting up those clear expectations. And how do we set up then goal consequences that really reward them and reinforce them for engaging in that goal behavior? And a note here, I love this note, rewards are more powerful than punishments, rewards and praise. And the most effective strategy is to use much more rewards and praise, and just a small dose of really time-limited negative consequences. And that's the most effective for handling behavior issues. All right, so in the slides, you'll be able to find them. I think I'm being asked to wrap up, but there's some steps to establishing behavior support plans for the classroom. Happy to talk more about those, especially how to monitor progress and modify the system over time, which is a sticky point for a lot of providers and teachers and staff, and how to work with the families to establish those positive consequences. All right, and so I'm happy to talk more about anything and answer any questions, but also would love to give time to the collaborative work together.